Good morning. This is Stites, Chief Medical Officer here at the University of Kansas Health System. Back with you today on the day before Halloween, also my sister's birthday, in case anybody wanted to know. Happy birthday, sister, if you're out there. And we're broadcasting live to you, with you from the Adolph Simons Family Studio, joined by Hawkeye and by Amanda Gartner, our Director of Infection Prevention, Quality and Control, and a bunch of other important titles, because she's a very important person who does a great job for us, so thank you. And we're here to answer your questions that have come in. Sometimes these questions come in through the week, and sometimes they just came in yesterday. We try to put them all together and answer some of the key topic areas. But before we go there, Hawk, how are you doing? How are we doing?
We could still be doing better.
Yeah.
But 37 patients in-house right now for active infection. That's better than the 40, I guess. But we still have 14 patients in the ICU and 5 of those on the ventilator. We also have 31 patients in that recovery phase and still 5 on the ventilator. So Hays still has a good amount of patients. 19 total, 18 are active, and 1 in that recovery phase.
So, yeah, that's a lot of patients and a lot of beds.
Yeah.
But, we're not El Paso, Texas. I saw a graph last night. They are having 15,000 new positive COVID patients a day in COVID. Now, remember, we're concerned in Kansas City we had 800 or 500.
Yeah.
They had 15,000. They have 600 positive patients in one hospital and 200 of those in the ICU.
Wow.
So that's known as being overwhelmed. We don't want to be El Paso, Texas. But, they were on this nice flat thing, and it started to accelerate, and it started accelerating right around the same time that we started to see our curve lifting. It's all about those rules of infection prevention and control. We can bend that curve. Let's first see, before we get into our program, let's first talk and see if there's media questions out there. All right, we're back. All right, so Jess, let's start with our first question.
Good morning. Okay, so can we really bend the curve and bring down to lower levels the cases if kids are back in school and bars are open?
Now, let's start with the hardest question of the day right now. I do think as the cases rise in Kansas City and hospitals get closer to capacity, that we really are going to have to re-examine some of the infection prevention control measures. We know how to bend the curve. We know how to make sure people stay safe, and I think we're going to have to take a hard look at every aspect of that, Hawk. What do you think?
Yeah, I think we can. I think those are two distinct things: schools open and bars open.
Yeah, I don't think the elementary kids are the ones in the bars.
I hope not.
Yeah.
I hope not. I mean, kids got to work though. Kids got to work. No, all joking aside, I think there's some more research out from, I think it was in Nature, but showing that really outbreaks in schools don't really happen. And if they are, they're pretty isolated outbreaks. What more is the large gathering areas, is the bars, is the restaurants, is the get-togethers with friends and family. That seems to be more of in play. There was a recent study, MMWR, with the CDC that showed the mitigation strategies. So wearing the masks, not going out in public and meeting in large groups, hand washing. Those mitigation strategies were lowest in the 18 to 29 population. So it's the young people that are getting out doing those things. And we understand that people are concerned, I have this blood type, I have that blood type, I have other genetics. It's really not a genetic issue. Everybody is susceptible to getting the infection. This is a behavioral issue. So that's what it is. So I think schools open and bars open are different things. If the children seem to be getting it, they seem to be getting it outside of the school. In those extracurricular things or meeting in groups outside of the school.
I think that's a big key too, and the impact of what the gatherings for kids are after school,
yes,
as opposed to the social distancing and the de-densifying that has occurred. When we think about it, we saw some data this week looking at the Lawrence campus, and these two folks have done a lot of work on the Lawrence campus to help keep that safe, and just hats off to KU Lawrence, because I think it's one of the success stories of how to open a school, that the prevalence rate on the campus is slower than the prevalence rate in the community.
Yep.
Tell us about that, Amanda. How do you think how was that done?
Well, I think we were really thoughtful in how they reopened, and they absolutely did a great job de-densifying the campus itself. Anytime I've been on campus to see the student activities, they've done a really good job of spreading out. Again, just limiting the capacity. Mask wearing is there's a handful of times that I've seen folks without masks on. But they're following the very basic elements of infection prevention that we've been talking about since the beginning of the pandemic. In regards to the bars, I think there are, not every bar is the same, not every bar layout is the same, so their ability to engineer or control the spacing within that space is dependent of the kind of the geography of their setting. I've been not in a whole bunch of bars lately, but like
I was going to say, careful.
Yeah.
You said
No.
you were inspecting those bars, right? That's what you're inspecting.
like you can walk by a bar and you can look in and you can see if they've got tables adequately spaced, or even sometimes they've got the couch setting where you're actually 6, 7, 8 feet across from another group. Some places have limited the number of folks that can actually sit at the bar, so you're not just right next to one another. I think it poses an extremely high risk because if you're eating or drinking, you obviously don't have your mask on. So that's your, that's your source
That's your
control.
vulnerable point,
That's
yeah.
your best prevention measure, and you can't wear that, so you're going to be in a highly vulnerable situation. And then typically as you have alcohol on board, your inhibitions go down, you're paying attention to the folks around you, and maintaining that social distance is going to be impacted. So can it be done safely? Probably, but do we have enough control measures in place all of the time? I think it's just a very high-risk situation. So I think bars and restaurants pose a little bit different environment than a school because you don't have as much control.
Yeah. So I think that's exactly right. And, the good news at KU, they did it well. They've kept their infection numbers very low, lower than the community. That's a remarkable statement to think about. Well, the campus would have to be endangered by the community. That's not what we thought was going to go on. So, you can do this right with schools open. You can do it right in the community. I think Douglas County is a great testament to that. All right.
How safe will it be to vote at the polls?
Well, I did. I got my sticker on, right? I voted a couple of weeks ago and did it absentee on the Missouri side, and it felt really good to me. I mean, I was happy to be able to vote. I walked in as a Union Station, kept the distancing 6 feet apart. People were washing stuff constantly. I mean, the people who worked the election, the polling place, did a great job as far as keeping the ballots clean, and that was really safe. And so I would encourage everyone. Get out and vote. Let your voice be heard. If you don't vote, then you can't have your voice be heard, and we need to hear all the voices. And so I look to our infection control experts here. I mean, you guys, you know what it is to be safe, and I think that what I'm hearing is that all the polling places are doing a really good job of trying to keep things
Again,
safe.
it's an extremely controlled environment. They're able
Yep.
to manage the capacity, they're able to wash the environment, they're providing hand hygiene, they're expecting folks to wear masks. I think it's extremely safe.
You
Yeah.
voted.
Yeah, absolutely. Again, I think polling places are different in whatever community you're in. My place in Johnson County is a little bit different probably than like we talked about yesterday. Other maybe urban centers or places that don't have as many resources. But the masking is going to be important. The lines should move through fairly quickly. You can do that. The masking was very good where I was at. And it doesn't matter if you're Republican, Democrat, Independent, Conservative, Liberal. The masking, the source control is going to be the important thing. And I know that the election boards are taking a lot of caution to implement those strategies for people to be able to get out and vote and do it safely.
Yeah, I have no fear about people going to the polls. And there's this, let's be a super spreader. No, it's not. The bars, that's a different question.
Yeah.
Big public gatherings, things like that. That's a place which you have to be worried, but not while you vote. You're going to be fine. Okay.
Dr. Stites, a couple of really good questions just came through this morning. They're work-related, so I wanted to get these in. Allison says she's a college student, and her classes are online, but she just got a part-time job at a retail clothing store. The customers and employees have to wear masks. Should my family start wearing our masks at home? I'm concerned about bringing the virus home to my parents.
Oh, that's a great question, and one we've had to wrestle with because it's all about that cost-benefit and that ratio and things like that. Guys, what we know is that when our team of folks who work in the hospital work in our patient care areas that are all COVID, that those teams, when the patients wear a mask and the team member wears a mask, they don't get COVID. So what do you think?
Yeah, so I think, so part of retail is that you're interacting with folks who are obviously not inside your normal bubble, but can you maintain your distance? Do you have to be within 6 feet of them? And in most situations, I would guess you don't have to be that close to the other folks, and can you limit that duration of time to under 10 minutes, limiting that risk of transmission? Obviously, if they're in a mask and you're in a mask and you're maintaining that social distance, you're always using clean hands, you're not coming into contact with your eyes, nose, mouth with dirty hands. I think I don't think you would need to put into place in addition to masking when you go home.
Yeah, that's where I would land, because I think that's our evidence is, again, the hospital floors, well, our patients and our staff aren't getting COVID from our patients. And so if they can be safe here, where you know you're taking care of a COVID patient by using the same thing about masking and social distancing and washing, then I think you can do it in retail outlets.
Yeah, I think it does start there at the store. So whether it's the retail outlet like that, whether it's fast food, whether it's the schools, it starts with the good systems, protocols, and management to enforce those types of things, and continue to re-educate the employees, but also the clients and the customers that come in, because mask wearing is so important. So I think doing it there and starting there, and just what you talked about, limiting your interaction. Even if you're looking at close with a client, you can still be 8-10 feet away and still be able to comment and help that client. Mask wear and mask use in the house has been shown to be somewhat protective, so that is always something to consider. But I think if you're doing those other things outside while you're at work, that should be as protective for you as possible.
What would normal patient capacity be for hospitals this time of year if not for COVID-19?
Oh, that's a great question. We'd be full because we're always full, and so I think I can't comment on every other hospital. What we know is that the hospitals in the area are getting busy, and it's getting harder to get transfers into Kansas City from outlying areas because hospitals are busy and they're full. And many places have a number of their staff who are out because they're either on quarantine because they've been they've been around somebody who's been sick, or because the staff themselves are sick. So I think our concern is that the hospitals may be getting full, both by COVID and because this is just the sick time of the year. We tend to get sicker. This is the time everybody's census starts to rise up. And in addition, a lot of people want to get whatever surgeries and things done they do while they still have their deductible before January. So this is just a busy time of the year all the time. And I think that's where hospitals are right now. I think it's really, really busy. And I think that's one of the struggles that we face, making sure that we're able to provide care to every patient, is if we get busy not only with COVID patients, but because there are other people who need care. We talk a lot about COVID, but the truth is there's just a lot of people who are sick and they need to be in hospitals to get care, and we don't want to not be able to take care of those folks. So I think it's just, that's what's making us busy. And if you think about it right now, I think we have 70 or 80 beds occupied either by COVID patients or COVID recovering patients. That's out of a normal census. I mean, let's say our peak census is 800, and 80 of those, that's like 10% shift right there of just one disease, and that's a big number.
Yeah,
so.
And the other comment I was going to make on that is that we still have we have a couple of units that have double occupancy beds that we aren't using. So typically those would be full and we'd still have patients waiting to come in here. So COVID is impacting us from a variety of points from a capacity standpoint.
And to your point that you said before, we have never had to overflow from one ICU because we have all the beds are taken to another ICU for one entity. So that has never happened for influenza. That's never happened for pneumococcal pneumonia. So again, pointing out the fact that COVID is a different entity from those other infections.
Yeah, some days when a bad day we may have 4 or 5 influenza patients in the
Correct.
ICU. We don't have 15 or 20. So it's nothing like, this is nothing like influenza. And to the question that is this influenza, you got to get over that question, folks. It is not influenza. And just go down and ask the people in El Paso. 15,000 COVID positive patients a day right now, and rising. And it's exponential rise. So this is not influenza. Just stop that.
Are there any silver linings to this pandemic? Are we advancing technology or medicine or industry? Everything feels so bleak.
There are always silver linings to every pandemic. And one of the things we try to do on this program is to talk about hope. Let's first of all just talk about how fast vaccines are being developed. I talk a lot about Star Trek because I'm a Trekkie.
You do.
By the way, I watched another episode of Discovery last night, and I love that. Dr. McCoy, what a remarkable physician that guy was, because there would be an infection in a Star Trek universe, and Dr. McCoy would synthesize a vaccine and treatment for it, and he had to do it really quickly before everybody died, and they got it done really quickly, and that would usually be 24 or 36 hours or whatever the duration of that show was, maybe 45 minutes. But historically, it has taken us a decade to get a vaccine. We're going to have a vaccine in a year. Right? That's crazy. And Russia and China are already using vaccines. That gives me the willies. But we will have a vaccine within a year. I think the vaccines will be out in January. the first wave of vaccination for the 1A group. I think that's going to come out in January by all indications. And so I think that being true is a remarkable statement. That is a silver lining. A second silver lining is the rapidity of developing monoclonal antibody therapy. Some preliminary data says that looks really, really good. That could be a game changer. So there are silver linings. Telemedicine is a silver lining. We've turned on telemedicine. We thought it would take us 5 or 10 years to build the platform. We built it in a couple of weeks. And now we do almost 1,000 patient visits by telemedicine a day. We can reach across the entire community of our region and our, Kansas, Missouri, bigger than that. We've done telemedicine in multiple states across the country. There is so many good things that have happened. I got a quote. The nurse I've worked with for probably longer than she'd like to say, but like 16 or 17 years, had a quote from a patient who said to us that the events that have the most power to transform us, we would never choose. The events in our lives that have the most power to transform us, we would never choose. Marriage and kids, that's pretty powerful, but a pandemic's pretty powerful. It has transformed many of the things we do. I think we have to find the hope in it, even as we deal with the changes in our life. So, what do you got? No, I'm done. Church is over. So what do you think?
So a couple of things that come to mind that I think about is the amount of, I've got members of my team who are now really, really excited about public health. And so they're seeking advanced degrees in public health, which I think is, that's great, getting bright minds into that industry. Our collaboration with our public health partners has been as strong as it ever has been. The collaboration really with everyone within this health system has really helped us to form very meaningful connections as we're all kind of going through this together, and we're really reliant on one another. So I think there's been a lot of silver linings in regards to the people that we're working with and the relationships that we're building.
Yeah, I mean, I think we've talked about work, and hopefully that also creates a better public health infrastructure for the United States in general, on a federal level, but also on a local level. But then again, individually in individual households, hopefully that's been a time for you to develop further relationships with, say, your kids, especially as kids get older in those teenage years where they're kind of heading out. If they're in shutdown and lockdown, hopefully maybe you're able to develop relationships with them more than you would have without the pandemic, or even the ability to get outside and walk. I know that was a huge issue, and we saw Luce Park was just packed with people early on in the pandemic because people were getting outside and enjoying the outdoors. So hopefully those are some of the just day-to-day silver linings as well.
All right, Jess.
Will there be a point in the future where I might get a COVID-19 antiviral pill at a drugstore?
Okay, let's take that one. Dr. McCrimey and Dr. Hawkeye.
I'm a doctor, not a TV host. Come on now. Yeah, I mean, that is the hope. That is the actual hope. We would like easy, accessible medications that are not IV medications that don't have to be given in the hospital. We've seen it with other antivirals. We've seen it with Tamiflu for influenza. That is the hope. There is research. There are companies out there looking at those types of things. So that would be very good. We would hope for that. But they are very early in the trials and the identification of those compounds.
So you say Tamiflu and I say Tamiflu. Which is correct?
Either one. Oseltamivir. The generic name.
All right, I like that. I can't say it very well, though. Man, I think there will be new therapy out there before we know it. And
we have to believe there is.
Yeah, and again, the monoclonal antibody therapy data, if you didn't see that, it's preliminary data in the New England Journal published this week, which is the best medical journal, the most reputable, demonstrated a drop in a phase 2 trial. It's not phase 3. That's where we really look at this as an endpoint, but in the phase 2 data, the percentage of patients who got monoclonal antibodies dropped. The rate of hospitalization went from 6.5% to or about 1.5%.
Something, yeah.
Folks, that's a game changer. If that data holds out, that is a game changer and will totally change how we treat.
And we are actually in the process of creating our systems here to be able to give those antibodies as an outpatient as well. We started that a week or two ago. So
it's an outpatient infusion that you'd go to an infusion center and get it. It's a one-time dose, and I think we'll be ready. And because we anticipate that will be out sometime after the first of the year. I think that companies are going for their early use authorization based on some of the early data, and we expect that that'll be out sometime in January or February, and that'll be a game changer. So. Okay.
We are getting so many great questions coming in this morning, if I can sneak some in.
You bet. Go.
So many people asking about Thanksgiving, how to keep seniors safe, what are they supposed to do with their college kids coming home for the break, how do they space with inside the house, should they all be wearing masks, should they get tested before they come over?
That's a great question.
Okay, all three of you jump in on that.
All right, so let's first start. Kids coming back from school for Thanksgiving. So, first thing, let's just say, if the community rate at KU, which it is lower, or the rate of infectivity, and we do prevalence testing on the Orange campus, if that rate is lower than the rate in the community, how much concern do you have to have about that kid who comes home?
I think it really is dependent on the kid, honestly. I mean, I think it's going to have to come back down to what has been the behavior. Not every student is the same. Not everyone's behaving the same way. So I do think you have to be cautious. You might be optimistic depending on the activities that your kid has been participating in. But I do think you have to be a little cautious. And not every college is
good. It's like as good as Lawrence.
They may not all be.
University of Michigan was in trouble.
That's absolutely right. There have been colleges that have completely shut down, large colleges, and I don't know how smaller colleges have been doing. So I think we have to be cautious as far as. And I had this tough conversation with my family earlier this week, actually, about what is the plan for Thanksgiving, because you're introducing 4 or 5 different households into one home for a vulnerable situation and eating at a table that typically isn't spaced appropriately. So we are actually probably not having a traditional Thanksgiving because we do have folks age ranges from children all the way up to seniors, and we're going to act probably on the side of more caution than traditional family gathering.
That makes sense.
Yeah, absolutely. I think it goes down to the individual student. Luckily, I believe most all of the colleges are probably ending at Thanksgiving, so they won't be back until February. So I think taking precautions ahead of time, if that college kid, and this is very difficult for any young person, to quarantine or self-isolate for 10 or 14 days prior to coming home, that will help reduce exposure in those preceding days. Maybe getting a PCR test prior to coming home, 1 to 2 days prior to coming home. It's all layers. It's not 100%, but those are things you can do prior to coming home to try and keep yourself safe and from having the infection.
I would just say I think that makes total sense. You have to figure out your home dynamic and what's the level of risk tolerance. My mother-in-law's 88, and she's a great lady. She's always, she is like the matriarch of the family, and is a wonderful person. And she's, and our kids, everybody, like we got to have her there at Thanksgiving. But I don't know that you can do it safely. And I think she said to us very wisely, no, I'm not coming over for Thanksgiving. And I think that's probably a smart choice. And I think if you can try to get a reach. Now, some colleges are testing kids as they leave. And so that may be one way of trying to figure it out. But that's one point in time. And if you've had an exposure, 14 days prior to that, you may not yet be positive, and then you can turn positive when you get home. So I think you just have to be right. I think, Manny gave great advice. I think you always do it. But I think that point, you got to know your kid. You got to know how they act. You got to know what their behaviors are like. And I think I do think knowing that college community and campus and how it's doing is really helpful. So I wish there was one blanket answer to that. I don't think it is. Here's my story. My daughter's coming in from Chicago. She's going to bring her boyfriend. I know that they're really good because we talk to her about it all the time. They're going to get tested when they leave Chicago, so when they come back. And then I think the first couple of days, she's probably going to have to wear a mask just while we make sure everything's cool. And then everybody's asymptomatic, we'll probably go ahead and take off the masks. But she is going to get a hug when she comes in the door. I'm just going to tell you, that's going to happen. And I think we all have to make those kind of decisions in our lives.
Yeah.
So.
We have a media question on the line from KSHB.
Okay.
Lindsay, go ahead.
Hey, good morning. It's Lindsay from 41. We are seeing an option for curbside voting on Election Day for folks who are differently abled, and also potentially for folks who may have been exposed to or have COVID-19. Would that be breaking quarantine?
I guess what does curbside entail?
Yeah,
Is it they hand you a ballot inside your car, you vote in your car, and you give the ballot back?
I think I'm okay with that.
That is, wearing a
as long as
mask.
everybody's got a mask and all that.
Yeah, I think there's
I'm okay.
really
I
low
think-
risk there, and I think that's a great innovative strategy for reducing crowds.
Yeah, if
I
the poll
agree.
worker can have a mask and a face shield or eye protection on, It's very little interaction if you're just
Clean
kind
hands.
of doing that. Yeah.
Yeah, I think I'm good.
But I guess the question is, are you breaking quarantine? Technically you are, but for the most part, if you're just in your car driving to that place, there's a system in place and you're going back home, I think that's reasonable.
Yeah, I'm with you. I think the right to vote's a big deal.
I have a follow-up to that, if that's okay.
Please, go ahead.
I'm just thinking with cold and flu season, if people wake up election day with minor symptoms, but they don't know that they've been exposed, they don't know if they've been around a confirmed case or not, now that we're seeing more spread, what would you recommend?
Yeah, no, that's
Staying
another
home from the
great
polls or
question.
no?
Yeah, and I was just going to pull from your answer about what we have learned from
The hospital.
well, the hospital, and then in the St. Louis at the hair salon where they were COVID positive, they had masks on, their clients had masks on, and there was no spread. So I think it still can be done. Ideally, you're not going out and about in the community if you have symptoms, but I think, again, the masking, the social distancing, the hand hygiene has been demonstrated to be effective.
Yeah, I'm with you.
And I think to Lindsay's point, if you don't know you've been exposed, unfortunately, we are seeing more and more of those cases here in our health system and friends who don't understand or know that they've been exposed. So, and that is just a sign and indicative that it's in the community because we don't always know where the exposure is. The contact tracing is getting more difficult.
Yeah, so I think masking up and having the other people mask up, I think you can do a lot of stuff. And even if you do have some mild symptoms, just have your mask and wash your hands and don't touch your face. And I mean, if you're really sick and you're coughing hard and all that, that's a different question, I think. And I think so it depends on what the degree of symptomatology you have is and what your likelihood of spreading it's going to be.
While we're on the topic of voting, Michael just sent in this question. Since Kansas does not require masks while voting, what makes you so certain it can be done safely?
So my experience is based in Missouri, and it's with the supposition that people are wearing masks, and hopefully that'll be the way most people do it. I think it's a county-to-county issue in Kansas, and I would just encourage everybody to wear a mask, and then you can feel safer. And I think if you go into a polling line, and everybody in that polling line right there, nobody has a mask on. I think just kind of wait till you get into a crowd, to a little cohort in front and back of you, have people who do have masks on, and then you can step in line and feel a little more comfortable. I think the polling places, most people who are working at the places are going to have on masks. Have you heard differently? How was it when you went to vote?
Yeah, so when I went, again, it was very good. Everybody had a mask, from the voters to the polling workers. There were 2 people with just face shields. Again, it's not barrier protection. I think their intention was okay. They just did not understand that. So it was very good there. So I think in Johnson County, probably masks are required, but I could be wrong. But when I went, everybody was in a mask.
And that's what I've been hearing too from the majority of folks that I've talked to who have already voted, that masking was looking very good. And I think to your point, you can control the time in which you go, and if you step in and it looks too risky for you, take a step back, wait for it to those folks to leave, and go back in when you feel more comfortable.
Are we safe 6 feet apart with these breath clouds that you speak about?
That's a great question. So it was cold last week, but when it gets really cold, it gets around 20 degrees, we're going to challenge everybody to go outside and send us a video of what their breath cloud looks like with and without a mask. We're not quite ready to accept those yet, but we're going to ask you to do your own test so you can see what that breath cloud looks like. It's coming. But having said that, the reality is if you go out and look at yourself in the morning and you can just kind of breathe and you can see it out there, you can say, okay, that's my breath cloud. If you are outside, that breath cloud, you can watch it. It dissipates pretty darn quickly, even before it warms and you don't see it anymore. But even as you breathe out, you can just watch it begin to dissipate. And I think what we have to realize is that breath cloud, 6 feet's a pretty good number. But partly it depends on how hard you're doing. If you're screaming and yelling like you do at a Chiefs game or at a basketball game or whatever, then that's different. You're going to be breathing a lot harder. If you're singing, you're going to be breathing a lot harder. If you're just kind of at rest, you're probably pretty good. You may be even 3 feet then. But I think the other dynamic is what the airflow is in the area you are. If you're outside, it's dissipating out on the outside. It's going to get blown away by the wind. You're really much safer. If you go inside without a lot of ventilation with the low ceiling, then that's just a different dynamic. Those clouds can hang around a lot longer, I think. So, guys.
Yeah, I don't have anything to add.
If our son was exposed to COVID-19 at work, does that mean we, as grandparents, should not visit our grandchildren? We miss them so much.
That's a great question, Hawk. What do you think?
Yeah, I think if it's an exposure and you've been designated as exposed at work, I think you need that 14 days of quarantine because you may have no symptoms. You can still spread it, when you have no symptoms. And I think so you do need to probably resist the temptation to go visit those grandchildren during that quarantine time. Wait for that 14 days, see if anyone in that house develops symptoms, and then you have to restart your clock as far as isolation days and things of that nature. But I think to be safest, it is probably going to be the best to not visit them during that 14-day quarantine period.
Yeah, I completely agree. I don't have anything else to add to that.
Yep, agreed. Okay.
Can you address large versus small droplets and how long they hang in the air? I'm confused about the CDC accumulative breath clouds.
Yeah, I think the CDC was confusing when they put out that recommendation, but I think they had to clarify the Hawkeye.
Yeah. Yeah, I mean, absolutely. So we know there are we've talked about this on the show, and certainly, being with the lung doctor and respiratory droplets, there are large droplets. None of these droplets we can really see. I think the best example you gave was really out in the cold or in the freezer where you can see those things. It just gives you a visualization. And then I'm not sure really about the accumulative breath clouds themselves exactly. We know that there are varying sizes, and within those sizes of micro droplets and micro aerosols, the virus particles can be there. Certainly we know, just as you talked about, if there is not a lot of airflow, those droplets can hang in the air depending on how heavy they are, how big they are. And if they can move to areas, they can move further than 3 feet, than 6 feet, depending on how much exertion you're doing as well. So I think that just kind of lends to the thing, the concept of we know how this virus is spread, and it is through droplets. Those droplets are various sizes. The heavier droplets fall to the ground quicker than the smaller droplets. If there's turbulent airflow, they are able to dissipate better. If there is stagnant airflow within the room, they are more likely to hang and travel further from the person that's expressing them.
Again, you did a good job answering that question.
Well, I think that this droplet thing is confusing, and I think the problem is that what we also know is that the really small droplets, they may hang in the air, but there's a lot fewer of them, and it's the bigger droplets that we come out with that is the most infectious, because otherwise this would spread like measles or tuberculosis, and it doesn't do that.
No.
All of our staff who take care of patients on the floors would be getting sick all the time, and that's not what happens. But they don't get sick, and so the staff that we see getting sick are usually with community contacts, and so I think we can rest assured that some of the doomsday analysis about these things can hang in the air forever, it can spread and go everywhere. And it just isn't true because the epidemiology shows it's not true.
Yeah, and I guess some of those studies have been done in a setting in which they are able to identify, is it present? What we don't know is just because it's present, is it going to lead to infection? And so it's important to separate those facts out.
And again, the proof, to me, is right there in our hospital, in our hospital. So, okay.
It seems like a lot of doctors are not testing younger children. So how are we able to know the actual spread among kids?
Yeah, okay, so I'm not going to answer this, and this is you, Hawkeye.
Yeah, I mean, that's a very good question. I think there's a lot of doctors who don't want to test adults either with symptoms, and I think that is not the best practice for identifying cases and slowing the spread of the disease.
We've seen some states, in fact, that have said, well, we're just not going to test as often.
Yeah.
Well, that's just a terrible idea.
Yeah. And I think we have to understand that there are capacity limitations to the tests that are available, but we're trying to promote testing as much as possible whenever reasonable, and testing those that we know have come into close contact with a COVID-confirmed patient. Another thing with the University of Kansas in Lawrence is the testing that they've been doing to really help identify their prevalence, and I think we needed that to better understand the disease.
And capacity has gotten better in general. There are other private labs that are able to offer that. You may not get the results right when you need it, but if you don't get the results, if you're taking a test, you need to be isolating at home if you have symptoms until you get that test result back. That's an important thing to remember as well. So I think we all want to do more testing, have more access to testing, and access to timely and efficient results. We aren't there yet. We're getting there. But hopefully, as we move through the fall, we'll be able to get that.
Okay.
Other than being safe and carrying with us the pillars of infection prevention and control, what can we do to support healthcare workers?
Well, thank you. First of all, that's a great question. We appreciate the question. But I think I think that's the answer. I think you've answered it. I think, we say, what else can we do? But what else can we ask people to do?
I don't know. I think these are the things that we want people to do. We want people to stay safe. We want to keep them out of the hospital. We want to allow our communities to open back up safely. And the only way to do that is to be utilizing those pillars of infection control.
Yeah, absolutely.
Yeah, that was awesome, guys. Well done. Okay, just a couple of things. So, first of all, coming up on Monday, Dr. Mark Steele, who's the Executive Chief Clinical Officer at Truman, Dr. Raghu Adiga, who's the Chief Clinical Officer of Infectious Disease at Liberty Hospital, and Larry Botts, the Chief Clinical and Medical Officer at Advent Health Shawnee Mission, will be on the program with us to talk about where we are as a community and how things are going in their hospitals as well. These guys have been on the program a couple of times. They do a great job, and we welcome them back. One of the things that has helped so much in this pandemic is the spirit of cooperation between the hospital and the communities in Kansas City. We're competitors in a lot of ways, but when it comes to coronavirus, man, we are in the same boat. And I just got a hats off to all the CMOs and all the healthcare workers and everybody in this, even the CEOs, all these folks in our metropolitan area, because just so you know, we're working together really well to try and help keep you safe. And to that last question, following the pillars of infection control, they travel with you wherever you may go, even when you're sitting down to Thanksgiving dinner. I want to say thanks for all of you out there who listen and listen to our program and help spread the news, because we can bend the curve. We have bent the curve before in Kansas City. We can bend the curve again. And that quote I heard earlier today, I think it just has stuck with me. The events that have the most power to transform our lives, we would never choose. Man.
It's good.
It is good. And it just it gets me to my core, and I think about that, and I'm like, how we react to this crisis tells the story of who we are as a person and as a country and as a community. Kansas City, let's be KC. Let's bend that curve, because we can do it. Wait a minute, we have done it, and we can keep each other safe. And that's who and what we want to be. So until we see you Monday, remember, follow the pillars of infection control, and there's still no place like home. We'll see you on Monday. How do we deal with this COVID weariness? How do we get through the next few months, especially until we have effective monoclonal antibody therapy and vaccination here, which I think both of those will be life-changing events for us? The first thing is accept that life will continue to be tough for a while. If we can accept it and say, okay, now I've accepted that principle, what do I need to do to still have fun? And that becomes the second tip. Looking for activities, new and old, that will help fulfill you. Don't just mourn what you can't do. Think about what you can do. Then tip number 3, and I really liked this one, expect less from yourself. Cut yourself some slack and give yourself some grace. Just know that you're not going to be in the same space you were in a year ago. This is going to be just different, and that's okay. Then number 4, choose to move and make physical activity a priority. Got to move around, because that really helps keep us safe. Then number 5, avoid doom scrolling. Limit social media exposure and be mindful of the types of news you consume. These are great tips. We stole them. They're right on target, and they're kind of what we see every day about following those pillars of infection control. And remember that now is not forever.